Hi, my name is Sophia Chung, and I'm a physician with the VA's Caregiver Support Program. Cardiac arrest can happen anytime and anywhere. In these emergencies, the heart stops beating or beats too ineffectively to circulate blood to the brain and other vital organs. Be prepared with a simple technique called hands-only CPR. You can learn it in minutes, it's easy to remember, and it can save a life. We're here with American Red Cross instructor Nate Rudolph, who's going to explain how to perform hands-only CPR. Thanks for coming here today.
Thanks for having me.
Nate, tell us a little bit about hands-only CPR. What exactly is it and when should we use it?
Well, hands-only CPR is an easy-to-learn skill that could save a life. It involves calling 911, sending someone for the AED if available, and then giving continuous chest compressions.
When would I know if I should use hands-only CPR?
Hands-only CPR should be used when you see someone who is unresponsive and is not breathing or only gasping. Having more bystanders train this simple skill can help save lives by putting more cardiac arrest victims within a few steps of life-saving assistance.
The VA and the Red Cross encourage you to learn the skill and step forward if you witness someone collapse and see they need CPR. Nate, would you demonstrate how to conduct hands-only CPR?
Absolutely. First, if you see someone who may be unresponsive and is not breathing or only gasping, check the scene for safety. See if the person responds to you by shouting, "Are you okay?" and then tapping them on the shoulder. Are you okay? If the person does not respond to you in any way, for example, by moving, opening their eyes, or moaning, then they're unresponsive. Next, briefly look for breathing. Is the person's chest rising or falling? Normal breathing is quiet, regular, and effortless. Isolated or infrequent gasp are not considered breathing. If you've gotten no response, call or send someone to call 911 right away and get an AED. Then, if the person is not breathing or is gasping, immediately give chest compressions. While kneeling to the side of the person, place the heel of one hand in the center of the person's chest. Place your other hand on top of your first hand and interlace your fingers. Hold the fingers of your bottom hand up so that your fingers are not on the person's chest. Position your body so that your shoulders are directly over your hands. This will let you push on the chest using a straight down and up motion, which provides the most blood with each push. It is also less tiring. Keep your arms straight and push down at least 2 inches for adults, and then let the chest completely return to its normal position. Push hard and fast. You want to give chest compressions at a rate of 100 to 120 compressions per minute. Maintain a smooth, steady down and up rhythm and do not pause between compressions. If an AED becomes available, use it as soon as possible. It will give you verbal directions on how to use it.
Stay calm. Follow these instructions.
If an AED is not available, keep going with the compressions. Do not stop compressions until one of the following happens. The person shows you an obvious sign of life, like breathing. The scene becomes unsafe. You're too exhausted to continue, or a trained responder arrives and takes over. I also want to mention that while hands-only CPR can be life-saving, learning full CPR is still very important. Getting trained in full CPR with combinations of chest compressions and rescue breaths will increase your confidence and may enable you to help in other types of emergencies. Full CPR is ideal for all ages and especially for people who are more likely to experience respiratory emergencies, such as children and infants.
Every household should have at least one person trained in these life-saving skills, right, Nate?
That's right. Nearly 75% of out-of-hospital cardiac arrests occur in the home. Prompt bystander CPR can increase survival 2 or 3 times in these cases. You can save the life of your loved one by taking immediate action.
If you are not trained in full CPR, hands-only CPR is simple to learn and easy to remember. We ask that you share this video with others so as many people as possible can watch and learn from it.